following training video presents several case scenarios of people who may have dry eye and may benefit from IPL treatment. The cases are fictitious and the optometrist should exercise their professional opinion before recommending and proceeding with any treatment. Patients with dry eye who are aware of their condition.
I have the results of your dry eye assessment. I can see two things. First, your tear breakup time is lower than average, which means your tears evaporate quicker between blinks than they should. Okay. This may be the cause for your discomfort. Okay. Second, your infrared mammography shows a deterioration of the glands that lubricate your eyes. If these glands deteriorate, they may fail to create a tear film that will protect your eyes from drying.
Oh, okay. Well, what can I do? Can you help me?
Yes, we may be able to help you. We have a solution using intense pulsed light technology.
Okay.
It's a very quick treatment, lasting 10 to 20 minutes per session. It's a gentle, non-invasive treatment, and 86% of dry eye sufferers have reported reduced symptoms following treatment.
Wow, this sounds great, but how much would it cost to have it done?
The full treatment will cost you $800 for 4 sessions. Any subsequent sessions, as needed or once per year, will cost $200.
Okay.
When comparing your options, it's important to consider how much you're spending on drops per year, considering eye drops only have a temporary relief to the symptoms of dry eye, whereas IPL treatment can target the cause of those problems with continued sessions. If you're happy to give it a go, let's proceed with a patch test today, and this will help determine the flash intensity we'll use in your treatment. What day would suit you best for your treatment?
Sure, let's do it next Tuesday then.
Next Tuesday.
Patients with dry eye who may not necessarily be aware of their condition. The second scenario will be similar to the first one, but in this scenario the patient isn't necessarily aware of their condition and doesn't complain of having dry eye.
What do you mean I have dry eye?
Look, Charlotte, on your report I can see two things. First, your tear breakup time is 4 seconds, when it should probably be above 10 seconds at least to be in the normal range. Okay? Second, your infrared mammography shows a deterioration of the glands that lubricate your eyes. If these glands deteriorate, they may fail to create a tear film that is strong enough to protect your eyes from drying. See how your glands are on this diagram?
Yeah.
This is where you are, and this is where the average is.
Oh, is it serious?
Bearing in mind that once your glands deteriorate, they will not regenerate. The best thing we can do at this stage is to maintain the level they're at and prevent them from getting any worse. Factors which contribute to dry eye include spending hours watching a computer screen or your phone screen, spending a lot of time in an air-conditioned environment, or aging and hormonal factors.
Okay, so what would you recommend to treat this?
We have a solution using intense pulse light technology, which will stimulate and unblock your glands and may help them function back to normal again.
Okay.
It's a very quick treatment, only about 10 to 20 minutes per session. It's a gentle, non-invasive treatment, and 86% of dry eye sufferers have reported reduced symptoms following their treatment. At this stage, we can still do something about it, but if you leave it as it is, dry eye can have a negative impact on your quality of life.
Patients with no symptoms, good non-invasive breakup time, but meibomian glands atrophy. On this third scenario, we'll focus on the infrared mammography and emphasize on how important it is to maintain the health of the meibomian glands.
Some of your glands are now blocked or atrophied.
What do you mean? My glands are what? Sorry?
You have about 80 glands on your upper and lower eyelid. The main function of those glands is to produce oils to keep your eyes lubricated.
Okay.
I'm concerned that although you might not feel discomfort today, over time the symptoms may worsen and it will impact on your quality of life.
Whoa, I had no idea about it. No one ever told me about dry eye or glands before. Is it too late to do something about it?
Look, it's not too late. We have a solution using intense pulse light technology. It helps stimulate the glands and return them to their normal function.
Okay.
It's a very quick treatment, each session lasting 10 to 20 minutes. It's a gentle, non-invasive treatment with around 86% of dry eye sufferers reporting reduced symptoms following their treatment. Factors of dry eye can include watching the computer screen for too long, or your phone screen, being in an air-conditioned environment, or age and hormonal factors. In general, IPL can help maintain your glands in good health.
Patients wearing contact lenses or wishing to wear them. In this fourth scenario, we want to offer an extra level of comfort to contact lens wearers and offer the chance of wearing them to patients that cannot due to their dry eye condition.
So from what I understand, you would like to wear your contact lenses every day, but it's not feeling comfortable.
Yes, indeed. I've tried them before, but I was never able to keep them in longer than a couple of hours at a time. So it hasn't been very practical as I would like to keep them all day long, you know?
Okay, after having a look at your results, I've noticed some blockage and atrophy in the meibomian glands. That might be why you're feeling some discomfort when you're wearing your contact lenses. If these glands deteriorate, they may fail to produce a clear film strong enough to protect your eyes from drying and maintain a comfortable use for a contact lens.
Okay, that makes sense. So what can I do to change this?
We have a treatment using intense pulse light technology, which will help stimulate your glands and return them back to their normal function. It's a very easy treatment lasting only 10 to 20 minutes a session. It's a gentle, non-invasive treatment with 86% of dry eye sufferers reporting reduced symptoms after their treatment. Factors which contribute to dry eye include spending long hours watching a computer screen or your phone screen, if you spend a lot of time in an air-conditioned environment, or age and hormonal factors. IPL can help maintain your glands in the best possible health.
Studies show that approximately 20% of our customers experience dry eye of various levels of discomfort. As a professional optometrist, it is your duty of care to recommend a treatment to your patient where appropriate. IPL is a preventative treatment that targets the cause of the problem, unlike eye drops which treats the symptoms. Cost of the treatment should be discussed at the end of the dry eye assessment. Always remember to compare cost against eye drops over 1 to 2 years, and the fact that IPL treats the underlying cause of the problem, not just the symptoms. Optometrists are privileged to be able to offer patients the latest in dry eye technology. It means not only diagnosing the condition, but also treating them and making their life better. Patients will be forever grateful that you recommended a treatment that can help bring lasting relief.